Are the minister and the critic ready to continue? The Honorable Minister of Health, Wellness, and Recovery, are you ready to start?
I'm ready to go, Mr. Chair.
I'm right there with you.
Thankfully not right beside me.
Will the Committee of Supply please come to order? This section of Committee of Supply will now resume consideration of the estimates for the Department of Mental Health, Wellness, and Recovery. As previously agreed, questioning for this department will proceed in a global manner. The floor is now open for questions. The member for Point Douglas.
Thank you, Mr. Chair. So I'd like to return to my question yesterday where I was asking how many people were suspected of drug overdoses during the pandemic. And then if the minister also had access to what the drug was that was overdosed on.
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and I thank the honourable member for Point Douglas for the question. 372 overdose deaths, and the main drivers of mortality in the 372 is for 2020, and the main driver of mortality in terms of the drug was fentanyl, methamphetamine, and cocaine use.
The member for Point Douglas.
So we do have that number from last year. Do you have current numbers for this year up to date, or if not up to date, maybe last month or July?
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and I thank the honourable member for Point Douglas for the question. At this time, I do not have numbers to share. Perhaps as the Chief Examiner's Office makes that information available, I will be able to take this under advisement and come back to the member with firm numbers.
The member for Point Douglas.
Miigwech, I appreciate the minister undertaking that and getting that information from the medical examiner. My next question relates to reporting and that other jurisdictions report publicly on overdoses. I'm just wondering if that is something that, you know, our province is moving towards, because we're vastly behind other provinces, and this is information that, you know, can help guide strategy in terms of helping to stop the overdoses, identifying the drugs of use, and making sure that ample support is there for people who are needing it.
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and I thank the honourable member for Point Douglas for the question. So my department will continue to collaborate with the Office of the Chief Medical Examiner and collect data, of course, to monitor the problematic substance use and related harms that is occurring in our province as well. We will continue to report on all available data in a timely manner to the public and other stakeholders in order to inform prevention and response activities. Public reporting, we continue to work towards making information as transparent and as readily available as possible. As I'm sure the member is aware, it does take time after someone is deceased to determine cause of death and which substances led to that individual's untimely passing. So we'll continue to work with the Chief Medical Examiner on reporting. Of course, COVID has also slowed many things within the health system as well as mental health addictions as individuals have been redirected to fight COVID. So yes, we are very committed as a department to addressing public reporting and making information available in a timely and efficient manner.
The member for Point Douglas.
Miigwech, I appreciate that, and I do hope that we are moving towards actually publicizing those on a provincial website so that Manitobans can actually see. And I mean, those numbers help, guide our government in the direction that it needs to go in terms of supporting people and making sure that no Manitoban dies of overdose. My next question has to do with bloodborne diseases. I've already asked this question in the House. We know that there's been 21 since July. Babies born with syphilis. We're now into October. Does the minister have an updated list or an updated number on how many babies? And then I'm just going to put a couple of other in there just for time's sake. How many were born with, or how many people have acute hepatitis B, and how many syphilis cases were there this year?
The Honorable Minister of Mental Health, Wellness, and Recovery. The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and want to make the honorable member for Point Douglas aware that my department has been asked to provide that information, and we are looking up that information now. If the member would like to move forward with another question, I know she has several. We want to be able to provide as many responses as possible. So we will come back to the response, but give the member an opportunity to ask another question.
The member for Point Douglas.
Thank you. I appreciate that you're taking that and finding that information and allowing me to go forward with questions. My next question is about the Virgo report. So the Virgo report called for 9% of the health budget to be focused on mental health and addictions. How much is it now? How much is currently being allocated towards mental health and addiction from the health budget?
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and I thank the honorable member for Point Douglas for the question. We certainly appreciate the hard work that has been done in the past by Dr. Rush, submitting his report in 2018 to our government. And I want to highlight that since receiving his report, our government has taken action in terms of allocating $52.3 million to over 30 initiatives to improve access to and coordination of mental health and addiction services. And we continue to move forward with ensuring that our system responds to the needs of individuals who are struggling with mental health and addictions. Now, the Virgo report had stated 9%, and that was sort of a gold standard percentage, and it's unclear to my department, Mr. Chair, what is included in that 9%. But I can say that the Canadian average is between 7 to 9% of the budget, and the national average right now is 7.2%. Manitoba is in closer to the middle and top at 5.6% for 2019-2020.
The member for Point Douglas.
Miigwech, Mr. Speaker. Can the minister tell me how many hours a week the RAM clinics are operating?
The Honourable Minister of Mental Health, Wellness and Recovery.
Thank you, Mr. Chair. And if the honourable member for Point Douglas would allow me to just clarify my previous response regarding the Virgo report and the percentages, that it's difficult to compare across jurisdictions or even nationally, because, for example, there are some services that still remain under the Ministry of Health. So haven't, for example, here's a good example, like naloxone. Naloxone is covered under Health and Seniors Care, but the operational work, working with the various organizations, comes under Mental Health, Wellness and Recovery. And I'm sure that's the same across the jurisdictions or even nationally, where some services are under different ministries. We see the same thing here in Manitoba, where we're taking that whole of government approach to addressing mental health and addictions, because some services are in justice, some are in families, some are in education. And so it's very difficult to say whether, in fact, the 5.6% isn't actually higher. So I just want to make the honourable member for Point Douglas aware of that. And I will respond to the question regarding the RAM hours shortly.
The member for Point Douglas.
Miigwech, Chair. So the minister, while she's looking for the hours for the RAM clinics, I'll just ask another question, and then perhaps they can look for that question as well. Can the minister tell us how many treatment beds are currently in operation in Manitoba, and break that down by site?
The Honourable Minister of Mental Health, Wellness and Recovery.
Thank you, Mr. Chair, and I do have a response for the honourable member for Point Douglas regarding the hours for the RAM clinics. I will start with the Crisis Response Centre. It's located at 817 Bannatyne Avenue. The regular hours are Tuesdays, Wednesdays and Fridays from 1 to 3 p.m. We then have the RAM Clinic at River Point Center, located at 146 Magnus Avenue. The regular hours are Mondays from 1 to 3 p.m. and Thursdays from 9:30 to 11:30 a.m. Individuals can also call Monday to Friday at 204-944-6209 or 1-855-662-6605. Brandon location is at 7th Street Health Access Center, and the regular hours are Tuesdays and Wednesdays from 11 to 1 p.m. Again, they can call 204-578-4800 Monday to Friday, 11 to 7 p.m. Selkirk is located at the Selkirk Community Health Office, 237 Manitoba Avenue. Regular hours are Tuesdays from 12:30 to 3:30, and individuals seeking assistance can call 204-785-7513. They can call Monday to Friday from 8:30 to 4:30. The Thompson location is at Eaglewood at 90 Princeton Drive. The regular hours are Tuesdays from 9:30 a.m. to 12 p.m. and Thursdays from 1 to 4 p.m. And individuals seeking assistance can call Monday to Friday, 8:30 to 4:30, 3 numbers, 1-866-291-7774 or 204-677-7300 or 204-677-7240. The posted clinic hours are for new walk-in patients seeking RAM Clinic service. In addition, the RAM Clinic team, physician, counselor, nurse, provides follow-up to patients, coordinating medication management, making referrals to other services, supporting and consulting with other providers, and informing other service providers about RAM clinics outside of those hours.
The member for Point Douglas.
Miigwech, thank you for giving me those hours. Can the minister also tell me how many people accessed RAM clinics and how long was the wait from when they first accessed RAM clinics to how long they got into detox or treatment?
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and I thank the honourable member for Point Douglas for the question related to RAM clinics, how many people were seen, and the wait times. So from 2018 to 2021, more than 5,700 individuals were seen. The wait time per individual is so unique to the individual. So we don't have one global wait time, and it would be difficult to flesh that out because it depends on the site, the treatment, and the intervention that each client needs. And depends on the service that they access. So that would be quite an administrative task to tease out service that is unique to an individual's presenting situation for 5,700 people.
The member for Point Douglas.
I appreciate the numbers from 2018 to 2021, but could the minister provide just 2020 and then perhaps 2021 up to date? And then just maybe a round number about how many people went into treatment in each year.
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair. And for the honorable member for Point Douglas, I do have an updated number with respect to the number of individuals that sought treatment at RAM clinics. Again, we have just the number for September 2018 to August 2021. We received the report, I think it was yesterday. The number is over 7,000. In terms of the number of individuals that accessed care, so for 2020, from April 1st, 2020 to March 31st, 2021, I could be off by a few, but 2,400 and around 94. And quarter one of this year, about 920 people have already presented. So if we look at the 2018 to August 2021, I'm informed that 1,765 people were referred to an addictions treatment program, withdrawal management, and or mental health services, and over 700 patients were started on opioid agonist treatment or therapy to treat opioid use disorder, and over 300 individuals were prescribed medication to treat alcohol use disorder.
The member for Point Douglas.
Thank you, Mr. Speaker. So I just pulled up a FIPA that was given to us in March, and the numbers were 4,751 people that had accessed services. So that's quite a difference. Like, that's over 3,000 people since January of 2021 that have accessed services. I hope that that number is, you know, presenting to the minister that there needs to be more supports for people if more people are presenting with, you know, trying to access services. I've certainly heard from some of the providers that RAM beds have been left empty, and how frustrated they are that they can't fill those beds because they're held for RAM patients. And then certain ones are held for Health Science Center, St. Boniface. Those beds are being filled. I know December that the RAM beds were empty for the whole month, and I had several calls from several people frustrated trying to get clients into treatment, detox, that couldn't get them in. And were frustrated because beds were left empty. So I hope that that's something that the minister will take under advisement, that if beds are, you know, left empty because there's no RAM clients that are needing them at that time, that perhaps those beds could be used, you know, for folks that do need them. So I want to go back to my other question. I had asked the minister how many treatment beds are currently in operation in Manitoba, and if the minister could break that down by site. So treatment beds by site, and how many?
The Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and I thank the honorable member for Point Douglas for raising the issue of the need for more supports, and that is why our government this year added additional funding of $819,000 to the 2 RAM clinics in Winnipeg at Crisis Response Center and at River Point Clinic. So that was funding to address wait time issues and the number of individuals that were presenting, and we continue to go across the province. List I visited, I think all the RAMs except one, which is at River Point, talked to the clinicians there, and individuals with lived experience about what needs to be done to ensure access to timely access to services at our RAM clinics. I do want to clarify for the honorable member that RAM clinics are not a bed-based service. So it's not intended to have individuals stay in, as we know it in the acute care hospitals or in other facilities, beds. So it is to, and I think this came out in the Virgo report, was that we needed to have greater linkages to the community and to primary care providers for ongoing care. And so for the individuals that may not have gone directly into detox or other forms of treatments, I'm sure that they were connected to possibly another community facility or service or back to their primary care provider. So it's not meant to be overnight stays, because it's not a clinical bed-based service.
The member for Point Douglas.
Which I totally understand the RAM model. It's a referral base, and there are beds held for clients of RAM, and that's what I was referring to. So they make referrals to, let's say, Main Street Projects Detox Center. Detox has to hold those beds for RAM clinic or RAM clients. And if there's no referrals, those beds sit empty. So that's what I was referring to. I wasn't referring to RAM, keeping folks overnight. I know that it's, 2 hours a day, maybe two days a week, which I think is insufficient, especially with the number of people that are presenting and the growing number of people that are, turning to addictions because of their trauma. And we see this every day. Those numbers are growing. People are losing their lives and resources are needed. So I want to go back. The minister still hasn't answered my question about treatment beds. How many are currently in operation? And if the minister can break that down by site.
The Honorable Minister of Mental Health, Wellness and Recovery.
Thank you, Mr. Chair, and I thank the honourable member for Point Douglas for keeping track of that question. I did note that it was not answered yet. I now have that information. Let's start with withdrawal management beds. And if we go to Thompson at AFM Eaglewood, it's 5 beds. At Hope North, it is 2 beds. And then if we go withdrawal management beds in Winnipeg, HSC Addictions Unit, there's 11. Main Street Project Women's, 26. Main Street Project Men's, 29. Clinic Mobile Withdrawal Management and Stabilization. It's in the community. There is 8. Marymount Youth Stabilization, 10. And if we go to Brandon at the Community Health and Housing Association, there is 6. If we look at supportive recovery housing, let's start with AFM River Point Apartments. There is 30. At AFM Community Pathways Men's Extended Residential Program, there are 10. Behavioral Health Foundation, 21. Esther House, there is 6. Addictions Recovery Inc., there is 14. Main Street Project Mainstay Residents, 34. 210 Men's Supportive Recovery Housing, there are 20. 210 Women's, 12. Indigenous Women's Healing Center, there are 15.
Then the next ones are the 100.
At Siloam, Tamarack, Riverwood, Community Health and Housing Association, as well as Men Are Part of the Solution. That is our 100 new supportive recovery housing that are in various stages of opening. Most will be open by the end of this year, or Riverwood, I think, is early early in January 2022. And now if we go to primary residential treatment, AFM Men's Winnipeg, 38. AFM Women's Winnipeg, 36. AFM Compass Youth Southport, 14. AFM Substance Use and Gambling, Brandon, 20. AFM Willard Monson House, St. Rose Dulac, 22. AFM Eaglewood Thompson, 18. Behavioral Health Foundation, Breezy Point Women's, 14. Behavioral Health Foundation Men's, Women's and Family, 85. Native Addictions Council of Manitoba, 22. Northern Health Region Rosaire House in the Paw, 16. Salvation Army Anchorage in Winnipeg, 31. Tamarack Recovery Center in Winnipeg, 12. And of course, I think I included as well the Bruce Oak Recovery Center in my last response.
The member for Point Douglas.
Which, Mr. Chair. So there's quite a significant decrease in the amount of treatment beds from 2015. Can the minister tell us why there's such a decrease, especially when we have an increase in addictions and treatment supports needed here in our province?
Honorable Minister of Mental Health, Wellness, and Recovery.
Thank you, Mr. Chair, and I thank the honorable member for Point Douglas for the question. We have two service delivery organizations that opted to close their facilities. Salvation Army Anchorage in Winnipeg, as well as the Behavioral Health Foundation, Breezy Point, opted to close those facilities.
The member for Point Douglas. The member for Point Douglas, we cannot hear you. Is your mic on?
Sorry about that. So that concludes my questions. I'd like to move to resolutions, and I just want to remind the chair that this is our opposition estimates time, and that we do have the next critic waiting. So I'd like to move quickly to close this section off.
We will now proceed to consideration of the resolutions. At this point, we will allow virtual members to unmute their mics so they can respond to the questions I will now call. Resolution 24.2. Resolved that there be granted to Her Majesty a sum not exceeding $18,471,000 for mental health, wellness, and recovery, mental health and recovery for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution number 24.3. Resolved that there be granted to Her Majesty a sum not exceeding $6,831,000 for mental health, wellness, recovery, wellness for the fiscal year ending March 31st, Resolution 24.3, resolved that there be granted to Her Majesty a sum not exceeding $6,831,000 for mental health, wellness, and recovery. Wellness for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 24.4. Resolved that there be granted to Her Majesty a sum not exceeding $62,039,000 for mental health, wellness, and recovery, physician services, psychiatry for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolved that there be granted to Her Majesty, resolution number 24.5. Resolved that there be granted to Her Majesty a sum not exceeding $253,071,000 for mental health, wellness, and recovery. Funding to health authorities for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 24.6. Resolved that there be granted to Her Majesty a sum not exceeding $266,000 for mental health, wellness, and recovery, capital assets for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. The last item to be considered for these estimates is item 1 bracket A, the minister's salary contained in Resolution 24.1. The floor is now open for questions. No questions? Resolution 24.1. Resolved that there be granted to Her Majesty a sum not exceeding $935,000 for mental health, wellness, and recovery, executive, for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. This completes the estimates of the Department of Mental Health, Wellness, and Recovery. The next set of estimates to be considered by this section of the Committee of Supply are for the Department of Central Services. I would now ask that the Honorable Minister and critic of the official opposition turn on their video to indicate they are ready to proceed. Will the Committee of Supply please come to order? This section of the Committee of Supply will now consider the estimates of the Department of Central Services. Does the Honorable Minister have an opening statement?
Yes, I do, Mr. Chair.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. It's my pleasure to be here today to discuss Budget 2021 as it pertains to the Department of Central Services. I'll give you a bit of a department overview. Central Services mandate is to be the service delivery organization for the Manitoba government, including procurement, information technology, or IT, as well as capital project delivery and asset management. As noted, part of Central Services mandate is to execute duties and functions related to capital management and delivery. The department's goal is to efficiently expend capital allocations on approved capital projects, consistently apply risk management to capital funding and projects, and improve asset management for all government assets. Through the central capital program areas, Central Services is responsible for, but not limited to, managing negotiations of bi- and trilateral capital funding agreements and partnerships, supporting the management of Manitoba's capital framework and the annual capital allocation plan, delivering and managing different departments' capital projects, including the use of innovative project delivery and project financing methodologies, and managing government's current capital assets, providing property services to owned capital assets, providing real estate services to government, and overseeing real estate and property asset disposal. Business Transformation and Technology, or BTT, is responsible for the delivery of centralized corporate information and communications technology and support services. The provision of strategic leadership to continuously improve Manitoba government's service delivery by planning and implementing corporate ICT solutions and policies to meet current and future needs. Consolidation and strengthening of Manitoba's technology investments and providing ICT risk management capabilities, business continuity capabilities, mitigation strategies, and disaster recovery strategies. The Procurement and Supply Chain, or PSC, business area provides strategic direction, policies, and processes for procurement and supply chain related functions across government. The department also represents the province in negotiations and participates in meetings related to digital service delivery and data analytics. Departmental mandate that we have in place now. As part of the mandate, the department will continue its efforts to save taxpayers' dollars by shopping smarter and working with stakeholders to expand Manitoba's procurement strategy across the public sector. The Central Capital Program areas seek to ensure predictable delivery of government's commitment to annual strategic infrastructure investments and expediting capital planning and project delivery through innovative project delivery process, including but not limited to design, build, and P3s. Central Services is also working with federal and municipal partners to deliver funding for worthy infrastructure projects within the Investing in Canada Infrastructure Program, also known as ICIP, and future bi- or trilateral programs. The provision of central coordination, negotiation, and delivery of strategic capital infrastructure and federal provincial infrastructure programs or projects are key strategic priorities of the department. Central Services also provides strategic leadership to continuously improve the Manitoba government's information and communication technology, ICT, environment through planning and implementing solutions to meet current and future ICT needs. The COVID response has, of course, been a big part of our department for the last many months, and Central Services has enhanced sourcing and distribution of critical supplies, equipment, and services, including personal protective equipment, PPE, vaccines, and rapid testing for our coordinated response to the COVID-19 pandemic. Central Services has invested over $460 million to acquire critical pandemic response supplies, equipment, and vaccines. I'm very pleased to say that over $241.7 million, or 45% of these purchase orders, have gone to vendors in Manitoba. Some of that product is indeed produced in Manitoba. Since the start of the pandemic, Central Services has focused on keeping Manitobans safe by ensuring our healthcare system, schools, and government departments have the supplies and equipment needed to keep providing Manitobans with the critical services they need, including ensuring we vaccinate Manitobans as quickly as possible, coordinating vaccination efforts with the federal government, as well as sourcing additional Canadian-made vaccines. This includes the rapid deployment of vaccination supplies and specialized storage to sites across the province, enabling shared health emergency bed expansion plans, including supplies, equipment, and sites to ensure Manitoba's hospitals are able to deal with rapid increases in patient levels, and ensuring that Manitobans have the services, including increased lab and rapid testing, contact tracing, and vaccination appointment scheduling that are critical to the success of our pandemic response. Central Services has played a critical role in warehousing and distributing the extreme volume of items required to respond to COVID-19, including over 360,000 square feet of warehouse space to support the purchasing, receiving, and distribution of PPE. Central Services, as the leader in public sector procurement in Manitoba, quickly adapted at the start of the pandemic, with staff from several Crown corporations and special operating agencies coordinating procurement efforts to identify, validate, and procure the supplies, equipment, services, and vaccines needed to keep Manitobans safe as we move towards reopening and keeping open our economy. Central Services has led efforts to engage local experts in healthcare and manufacturing. Many local businesses have retooled their operations and shifted their focus to produce life-saving supplies. Others have provided access to their own supplies and supply channels to PPE. This approach ensures as much money as possible stays in our province, supporting local employers and manufacturers. Manitoba's investment in pandemic supplies, personal protective equipment, rapid testing, and vaccines allows us to respond to this pandemic effectively and vaccinate Manitobans as fast as possible. Our investment is not only in addressing this pandemic, but also in items like Made in Manitoba reusable N95 masks and Made in Canada vaccines to better prepare for future emergencies. Manitoba's collaboration with local businesses in our pandemic response has ensured that as much money as possible has stayed in our province supporting local employers. Thank you, Mr. Chair.
We thank the minister for those comments. Does the critic from the official opposition have an opening statement? The member for Fort Garry.
No, we don't. We just want to proceed to global questioning.
Under Manitoba practice, debate on the minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 8.1A contained in Resolution 8.1. At this time, we invite the minister's staff to join. Oh, no. Okay. Does the committee wish to proceed through the estimates of this department chronologically or have a global discussion? The member for Fort Garry.
We're seeking a global discussion.
Is a global discussion satisfactory to everybody at the table? The Honorable Minister of Central Services?
Yes, that's acceptable,
fine.
Mr. Chair.
Agreed and so ordered. Thank you. It is agreed that the questioning for this department will proceed in a global manner with all resolutions to be passed once questioning has concluded. The floor is now open for questions. The member for Fort Garry.
Thank you. I'm wondering if the minister could provide a copy of the 24/7 In Touch contract and any amendments made to the initial contract.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So there are two parties to those contracts. Obviously, the government of Manitoba and the private supplier. And since we don't own the contract by ourselves, we have to ask the private supplier if that can be disclosed. The member knows that he's asked this question about Bell contracts in the past. And when we went to Bell, they chose not to disclose that contract. So we will ask 24/7.
Sorry, the member for Fort Garry, I didn't have my mic on.
Sure. The original contract was for $5.8 million, and that was March of this year. That went up to $13 million in April, $27 million in June, $34 million in July, and most recently over $40 million in August. Can the minister explain these significant increases in the contract?
The Honorable Minister of Central Services.
Thank you, Mr. Speaker, or Mr. Chair. So public health started out with the contact tracing, and they quickly found that they needed some assistance in that. We are like all other provinces in Canada, that we used a public and private model in contact tracing in order to make sure that we had enough capacity and that public health could deal with the more complex cases, and the privates deal with the I don't want to say easier cases, but the less complex ones. So we moved to contact tracing with 24/7 to augment public health. We also used the Red Cross and StatsCan for contact tracing in that area as well, to make sure that we had capacity so that we were not overwhelmed with contact tracing. It was a very challenging time, as I'm sure the member will recall. And after that, as we went into the COVID testing sites, we found a necessity to enable 24/7 to book those tests for individuals so they could go for appointments for testing and find out where the testing sites were available, as opposed to standing in line for an extended period, even in the cold sometimes. So that was something we were trying to avoid there. And then again, we had the historic vaccination rollout, something that's never been done in Canada before on this size. And the appointments for testing were done through a combination of 24/7's phone banks, and also through our online system. At sometimes we were booking 40,000 appointments a day, and I'm sure the member will recognize that that was a tremendous undertaking to make sure that we could get people appointments in sites close to them so that they could get that vaccination done quickly. And then finally, we also moved, as we moved into our proof of vaccination record, access to it. It was intended as a digital record, but quickly found that people wanted a physical record as well, and they needed some help in getting that record. So we used 24/7 to help people work through that process, both online and through the phone center. And we also had a few people that we need to validate their records, that maybe they had forgotten to change the address on their record, or the system hadn't picked up their address change. So we needed to make sure that indeed the people that were applying for that record of vaccination were the people that were on the phone, and making sure that that identification was incorrect. Was correct.
The member for Fort Garry.
Can the minister tell us how many contact tracers that this actually paid for?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So the contract with 24/7 was allowed us to be volume driven, so we could scale up as necessary. And at one time in Manitoba, we had in total over 600 contact tracers, including all contract tracers, that were able to respond to Manitobans' requests.
The member for Fort Garry.
How many contract tracers were hired from this specific contract, excluding all the other outside agencies like Revenue Canada, et cetera?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So from this particular contract, around 400 was the maximum that we did use through 24/7.
The member for Fort Garry.
And what was the cost to hire 400 contact tracers with 24/7 In Touch?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we'll have to take that one under advisement if we can, because the contract is for all of the areas that I described, not just for contact tracing. So we would have to break out what the contact tracing was if that's something that you'll allow us to get back to.
The member for Fort Garry.
Certainly. I'm wondering if the minister could tell us how many contact tracers that 24/7 currently employs as of today.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. We still employ up to 400 because we've not stood down our contact tracing. We continue to do so. We're currently in another wave, and we've continued to do contact tracing all the way through.
The member for Fort Garry.
Wondering if the minister could provide the RFP for this contract.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. Yeah, I believe we found that RFP and we can provide it to the member. We had 9 respondents to it. Of course, we can't disclose who those respondents were.
The member for Fort Garry.
So the minister indicates that there's still 400 contact tracers underemployed with 24/7. How long has this contract been extended for, and how much more do they expect to spend on this contract?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So the contract expires in November and we're seeking to extend it into March 2022. Again, it's a volume-based contract and the member can tell me when the pandemic's going to end. I can tell them when we won't need that contract anymore. It is something that we can cancel when it's no longer needed.
The member for Fort Garry.
Now, I just wonder if the minister can clarify my understanding of this. It appears that the contract's been extended on 4 separate occasions, and you're saying there's a 5th planned. But in each of these extensions, new services are being provided. Do I have that correct? So this wasn't the same contract from the beginning. They're doing different and more well, obviously unanticipated work from that original contract. Do I have that correct?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. Does this microphone work okay for you, or is it muffled? You want me to go back to a headset, or is this microphone work all right?
I can hear you fine.
Hansard is recommending if you could use a headset, it would be preferable, but there are times when you're sort of a little bit muffled.
All right, we'll go back to
the Honorable Minister of Central Services. We lost you there for a second.
All right. Well, I'm switching back and forth from a headset to speakers so that staff in the room can hear the member's question. So that's, if there's a hitch there, that's, unfortunately the Zoom platform doesn't allow me to use separate speakers and headset. So in respect to the member's question, so we started with 24/7 with contact tracing, and the pandemic evolved, as I'm sure he's aware, as all people are aware, that it changed over time. And contact tracing was a critical part of our response to it. And as public health or as our government labs responded in the testing, we found that we had to enable appointments for those labs as well, and expanded into other laboratory services as well. So we expanded to testing appointments, and that was a time where we didn't even consider that vaccinations might be a possibility in Canada. I do recall a meeting I had with Minister Anand at the end of October, asking her about vaccines. And at that time, she had said, so this was a year ago, I asked her, we're hearing about vaccines. Can you give me any information? She said, I don't have any information I can share with you. I asked her if she could give us some information about some particulars of one that we had heard rumors that we might have to store at ultra low temperatures. And again, she said, I have no information for you. So that was a year ago, that there was no line of sight into vaccines coming to Canada anytime soon. And as the member will probably know, that we received some in December, mid-December. We were able to take them with freezers that we put in place. So again, at that time, we had to find an opportunity in a way that we could have appointments for those vaccines, and 24/7 was further engaged to do that. And then as we look forward yet again, we knew that we would have to have some form of proof of vaccination card available that was secure for Manitobans. And in developing that card, found as we rolled it out on our websites and everything else that Manitobans needed some help to get those cards, to sign up for them, or to change information that was in our health database to make sure that it was all accurate. So these are all things that came up very rapidly, could not be anticipated, and were not something that we could do internally to government.
The member for Fort Garry.
So if I hear your explanation correctly, there was only one RFP at the initial contract, and the 4 renewals were essentially no bid contracts and no new RFPs, no new competitions were issued. Do I have that right? And then we're going into a 5th renewal, which is a new no bid contract for this company.
The Honorable Minister of Central Services.
Mr. Chair. So this was indeed an extension of a tendered contract for additional services. I trust that the member understands that we are still in a health emergency, a pandemic, and there's certainly no time for governments to issue a new RFP and wait for people to respond to an RFP. I can't imagine managing 5 separate contracts for 5 separate providers, educating their staff on all of the things that we were doing. These were emergency responses that we had to have available for Manitobans, and was an extension of that tendered.
The member for Fort Garry.
So again, I'm trying to be very clear here. The initial contract was with finance, and it was simply moved over to central services, and there was no second contract with central services. There's only been one initial competition and one initial contract, which has been extended 4 times, and there's a plan for a 5th with this government. And I have all that correct?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So the member is correct. Finance does own the contract, and Central Services manages that contract.
The member for Fort Garry.
I'm wondering if the minister can advise the committee how much has actually been paid out to 24/7 In Touch as of today's date.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we're to the point where we have about $5 million left in the contract that was allocated, and then we may have to determine whether we have to go back to Treasury Board for additional funding or not.
The member for Fort Garry.
If the contract's extended to March, and that's the intention, wouldn't it be a foregone conclusion that you'll have to get even more money for this contract?
The Honorable Minister of Central Services.
Thank you, Mr. Speaker, or Mr. Chair. So, we have, as I mentioned, $5 million that's left allocated for that contract, and we don't know. I don't imagine the member opposite knows where we're going to go in this pandemic, how much longer we'll need these services. We'll see where that gets us to in this current wave. And if we need to go back to Treasury Board for further allocation, that'll be determined at that time. But right now, we're working with that current allocation.
The member for Fort Garry.
So, given that this company's contracted with the province since March of this year, you obviously have an average being spent every month that's been established. What is that average? Is it roughly about $5 million a month that's going to this company for contract tracing and other services?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So the contract has fluctuated significantly over the length of it. Wouldn't be able to give the member an average. It's sometimes very high, sometimes minimal, because it's volume based, and that's the way it was designed, so that when we have to ramp up the need of the services, we can certainly do that. And when the services aren't necessary, we can roll them back so that there aren't that many people working in this environment, but there's no real average that I can provide.
The member for Fort Garry.
Now, as the minister is aware, and I asked him a bit about it in the House today, we had some brave whistleblowers come forward in June of this year who basically let Manitobans know that this call center was doing a pretty shoddy job, unprofessional even, in relation to contact tracing and providing misinformation to Manitobans. That was certainly putting the community at risk. At that time, in fact, I'm referencing a public statement your government made on June 12th, 2021, where your government said that it would monitor InTouch's performance and decide whether to extend the contract by 3 months beyond the August 24 expiration date. Now, I'm wondering, obviously you've extended, who conducted that review? What did it consist of, and where can we get the results of it?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we've had complaints from about contact tracers from all areas of government, not limited to 24/7. So we worked with, in conjunction with Public Health, to do a review of contact tracing. And this is just regular contract management that we conducted. I guess to point out to the member, one of the complaints that we did hear about contact tracing is that we needed more languages available to people that were calling in. And that's certainly something that 24/7 was able to enable, to bring in other languages to make available to Manitobans. It's, as you know, the government itself works in English and French. And this is something that we were able to expand with 24/7. And I want to remind the member that Manitoba is one of the very, very few provinces, if not the only province, that did not have to suspend contact tracing. We were not overwhelmed like some of the other provinces are. Other provinces had to suspend contact tracing altogether, but because they just couldn't keep up. So our mix of the public and private model allowed us to get that contact tracing done. We'd always like to get it done quicker. And as I'm sure you've heard Dr. Rusin talk about some of the contacts of individuals, up to 50 individuals, it takes a long time to trace those contacts. And we certainly depended on public health for the more complex one.
The member for Fort Garry.
So despite your government's pledge to investigate the allegations against 24/7 In Touch, there was no specific review of those allegations or that specific company. Do I have that correct?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So again, we worked with public health to review and constantly look at the contacts that we had from all of our contact tracers and respond and educate and make sure that we could have the quality and the quantity available that was necessary for Manitobans. Not once did we had to stand down our contact tracing in Manitoba as other provinces had to do. It was something that was constant, it was continuous. We had review of any complaints that came forward, and we resolved those complaints.
The member for Fort Garry.
I'm taking it, given that the minister is not answering a direct question, that the answer is no. 24/7 In Touch was never investigated. The allegations were never looked into, and they were not part of any sort of systemic review by official in public health. That is correct, isn't it?
The Honorable Minister of Central Services.
Thank you, Mr. Speaker. I'd thank the member if he wouldn't put words in my mouth. That is not indeed what I said. I did indeed say that we worked with public health to resolve any and all complaints with all of our contact tracers, including 24/7. It was a continuous improvement exercise that we do in all of our contracts that we work with.
The member for Fort Garry.
Was there a specific investigation of the allegations leveled against 24/7 In Touch by your department or any other branch of government, yes or no?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. Well, I've tried to portray to the member, he wants a yes or no to an answer to, indeed, we work with public health and all of our contact tracers, including 24/7, to resolve any concerns that people had, any and all, to the satisfaction of public health. So if you want a yes, I guess that's as close as a yes as I can get to the member, but it's not something that we stop doing. We still continue to do so. When someone complains about an issue, we take it up and we resolve the issue.
The member for Fort Garry.
What were the findings in relation to 24/7 In Touch allegations? Were they substantiated? Were they found to be wanting? What was the results of the review in specifically those allegations and that company?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So again, our department has responsible contract management that we continue to use all the time. We work with public health. We work with other groups that are doing the contact tracing, including 24/7. We involve public health in any of the complaints of anyone that is involved in contact tracing, and we resolve those issues. And it has been to the satisfaction of public health for all of those contact tracers. And again, I want to reiterate that we are one of the few provinces that did not have to stand down our contact tracing in Manitoba. We were able to meet the needs of Manitobans and trace some of those very, very complex contacts, and some of those complex contacts that required other languages.
The member for Fort Garry.
Can the minister provide the names of who engaged in that review? We could certainly ask them ourselves.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So these are civil servants and public health officers. I can't disclose their names to the member. These are, I'm not looking to go on a witch hunt anywhere. If that's what the member wants to do, I certainly would dissuade him to do so. We were managing this contract with public health and 24/7, Red Cross, and as well as StatsCan. We're dealing with issues with all of our contact tracers to the satisfaction of public health.
The member for Fort Garry.
Who was the senior manager or the top official in charge of this review that reported to the minister?
The Honorable Minister of Central Services.
As the minister, I am ultimately responsible.
The member for Fort Garry.
Who was the official that reported to you the results of the review, and when did that report occur?
The Honorable Minister of Central Services.
Thank you, Mr. Speaker. I'm a little disturbed by the approach here that he seems to want to out civil servants when they make complaints. We have a culture of an open culture in this government. I know his previous government didn't have that. It was a very closed culture and people were not encouraged to complain. So when we have complaints, we follow them up and we make sure that people's identities are discreet so that they are welcome to come forward with any complaints, and we encourage that. Any issues that we had with contract tracing were resolved to the satisfaction of public health. And to me, we continue to do so. This is a continuous improvement exercise all the way along.
The member for Fort Garry.
Okay. I'm concerned this minister is attempting to mislead this committee, so I'm going to ask this again, and hopefully I can actually get an honest answer. You have stated that there was some type of formal review taking place within your department about the allegations specifically coming out of 24/7 Touch. What I've asked is, what was that process? It was a formal process, you say. Who reported to you, and when was that report happening?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. Again, I'll thank the member not to put words in my mouth. I have never said there was an individual audit or review. That is his words. This was a continuous process all the way along. It continues to be a continuous process. When you receive complaints, we meet with the various groups that are involved. We address the concerns, we find resolutions, we take corrective action if necessary, and we improve the services. This is something that we are working through all the way through this pandemic. An issue comes up, we find a resolution.
The member for Fort Garry.
Well, with the greatest respect, the minister's version seems to be evolving this afternoon. So to be absolutely clear here, there was no formal review ever taken. There's no existence of a report or a review that was ever given to the minister. And what the minister is referring to is that this matter was dealt with informally, internally. Is that correct?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. Again, I'll thank the member not to be putting words in my mouth or on the record that aren't correct. We dealt with many different matters that were brought to our attention with all of our contact tracers. And it is something that you do in managing contracts and managing organizations. You deal with expectations, you deal with delivery, you take corrective action and recommendations on how there can be better outcomes. It is not a conflict that we seek to engage in. We want to make sure that all of our contact tracers continue in their employment. And it is a very, very difficult world that they have been working in, as I told the member in question period today. The online telephone abuse that they've received from individuals that don't want to give them information. They have to encourage and call back and try to get that information from people that are very reluctant to give them that information. So it is a very trying and difficult job for all of our contact tracers, and we want to make sure that we enable them to be successful. So if the member is looking for something that is, I don't know, a conflict, that's not the way we resolve things in our department anyway. We work with people to be successful.
The member for Fort Garry.
I'm certainly willing to move on with my questioning here if I can get a straight answer from the minister. Can you please confirm that there has been no formal review or report of these allegations, and that this was an informal process and nothing has ever been sort of presented to you in the form of a review or a report?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So indeed, we do have, as I mentioned, a formal and ongoing review mechanism that we use with all of our contracts and with all of our contact tracers. There's no single report that this produced. It's ongoing, it's continuous. We continue to get recommendations for improvements from not only from public health, but from the civil service and from the public at large. And we review those recommendations with all of our contact tracers and public health and make those improvements to the system if we can.
The member for Fort Garry.
Given your informal review, has there been any changes to the training protocol or any sort of reaction to the allegations that you went back to 24/7 and new policies were put in place, new training regiments were updated? What was the fallout from those allegations, and had any changes been made at 24/7?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. And I've mentioned many times here that we do continuous improvement throughout all of our contracts, and that's what we did with all of our contact tracers, including 24/7. Some of it involved additional training, some of it involved additional language use. So it was just a continuous improvement process with all of the contact tracers. And sometimes some of that improvement is just making sure that they're appreciated, because we know that they're doing a very, very, very difficult job. I don't imagine that I could do this job. I wouldn't wish it on too many people, but there are people that are very excellent at this. And we had all of our contract tracers working to make sure that Manitobans could stay safe and we could find their contacts. And again, we are one of the very few provinces that didn't have to stand down our contact tracing. We were successful in finding those contacts and making sure that we could recommend to those individuals how they could keep them and their families safe.
The member for Fort Garry.
Who conducted those training sessions? Was it staff from public health, or was it 24/7 in touch staff internally.
The Honorable Minister of Central Services.
Yes, both and all were involved in all aspects of this, sometimes with public health, sometimes with the Red Cross, sometimes with StatsCan, sometimes with 24/7. And we involved each and everybody along the way to make sure we had the best response to Manitobans.
The member for Fort Garry.
Could the minister provide an update as to where things are with Providence Therapeutics?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we continue to have regular conversations with Providence to be informed about their process and what they are able to do and where they are in their testing regime, so that we can make sure that we have what Manitoba needs should there be another pandemic. I'm sure the member knows that we were searching all over the world to try to find vaccines for Manitobans, and that included talking to all of the manufacturers that were identified by Canada to seeing if there was any access that we could have to those vaccines, if we could access vaccines from the United States, or if we could make a deal with North Dakota, as we did with the ability to vaccinate the truckers that were going into North Dakota. And I think I would be remiss if I wouldn't say that we're looking ahead to what might happen down the road. We don't know if there's going to be another pandemic, but I think it's critical that a made in Canada vaccine of any type would be available for that future pandemic, and Providence is one of those potential providers.
The member for Fort Garry.
Has any money been paid out to Providence to date?
The Honorable Minister of Central Services.
No.
The member for Fort Garry.
Wondering if the minister could provide a copy of the contract or the term sheet as been previously committed to by his government.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So the term sheet was disclosed publicly in February 2021. If the member can't find it, we can certainly make it available to him. It is a public document. The discussions that we have had ongoing with Providence we'd look to make changes to that term sheet as circumstances change. One example was Providence was looking to do testing, phase 1 testing, phase 2 testing in Manitoba. And that's pretty difficult when we have 85%, 86% of the population vaccinated, when there's only 15% possibility that they could test a vaccine on. So those are the types of conversations and changes to the term sheet that we would be enabling with Providence.
The member for Fort Garry.
What's the current vaccine stockpile that is present in Manitoba today?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So suffice it to say that our arrangements with Canada have been very successful, that we have more vaccines than we, I guess, have arms that don't have vaccine in Manitoba. We're looking to what would happen with a third dose and how that would be rolled out. We're already doing that, as you probably know, in some of the personal care homes and vulnerable populations. But in terms of an exact number, it changes all the time, and we could endeavor to get that for the member.
The member for Fort Garry.
I take it from your comments that we obviously have more vaccine than we need in Manitoba, and if we needed more, we just simply have to request it from the federal government. Is that true?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we do work with federal government to look at where we need to be in our current vaccine stock. We are presently have, as I said, plentiful supply. That was not always the case. I'm sure the member will remember when we were allocating scarce resource or did not have any of that resource, and we don't want to be in that situation again. That is certainly why we're looking towards companies like Providence or other companies in Quebec or Saskatchewan that are very encouraging research in vaccinations or vaccines. But currently with the approved vaccines that Canada has, mainly, of course, Pfizer and Moderna, those are the ones that are prevalent in Manitoba. The others are a little more difficult to come by. Depending on the demand, but those ones we do have adequate supply in Manitoba at this time, but there certainly was a time, I'm sure the member remembers that time where we did not have that supply, and going forward we want to make sure that we're not in that circumstance again.
The member for Fort Garry.
So you would agree with me the federal government has made no indication that they will limit the supply of vaccines to any province, including Manitoba. Given that we get free vaccines from the federal government, why would we turn around and purchase extraneous amounts of new vaccine which Manitobans would be on the hook for. How is that good fiscal management?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we continue to evaluate and assess where we are with vaccines, and it's certainly something that I'm sure the member wouldn't want us to be in a scarce supply. We don't know what the next pandemic is going to be. It was certainly a very dark and dangerous place when we had no vaccines in Canada and no producer, no supplier at all. And we want to make sure that we're not in that environment again. We have local companies, we have local providers in Canada and Manitoba. It's also an economic development and a jobs opportunity for Canada. I don't know that we want to export all of our abilities to other countries. It's certainly not the case of where we are in PPE. We have many, many companies that have stepped up production of PPE in Manitoba that we depend on for our supplies, and a vaccine is just one more of those things that we're looking at to ensure that Manitobans can be protected in future pandemics so that we don't have to depend on other countries as we did in this current pandemic.
The member for Fort Garry.
The G4S company was awarded a contract to employ 90 staff to enforce public health orders. According to proactive disclosures, $6.6 million was contracted. How much has been paid out to G4S to date?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So the G4S contract that was secured through a competitive RFP, was done through our department as we manage many of these contracts, but in terms of the expenditures, those are under Justice, and you'd have to go to ask the Minister of Justice for those details.
The member for Fort Garry.
Wondering if the minister can advise how many tickets and warnings have been issued by G4S staff to date.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. And again, that's a question for the Minister of Justice. They're the ones that are in charge of how G4S is used and where they're used, and that would be information that Justice would have.
The member for Fort Garry.
Is the minister in a position to tell us how many enforcement officers are currently enforcing public health orders that are employed by the province?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. Again, a question for the Minister of Justice. They're in charge of enforcement for the COVID rules and how that's administered.
The member for Fort Garry.
Pedal MD was awarded an initial contract in November for $436,000, a new contract in April for $1.7 million. Are these different contracts or are they amended ones? Could the minister explain sort of what the contract in April was for?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So the initial contract was an online booking tool that was used for the testing sites so that you could find out where you could get a test done and book that test so you didn't have to wait outside the cold. And then as we received vaccines into Manitoba, we also then used that same online booking site that Manitobans were used to go and book their vaccination appointment if they wanted to do it online.
The member for Fort Garry.
So despite in the change in terms in the contract, a new RFP didn't go out and a second non-bid contract was issued to this company. Is that correct?
The Honorable Minister of Central Services.
Thank you, Mr. Speaker or Mr. Chair. So again, in a pandemic when things change dramatically overnight, you need to respond quickly. And this was one way in that we were able to respond quickly to Manitobans' needs. As I remind you of the conversation I had with then Minister Anand, that she told us she had no information about vaccines, and then within the space of a couple of months, we're receiving them with a day's notice in Manitoba and having to roll out vaccinations. And you well know the demand that we had for vaccinations at that time, with a very, very, very limited supply. We were getting calls all over the place for a need to get vaccines. So, we needed to stand up something very, very quickly to enable Manitobans to book appointments and to find those not only testing sites, but the vaccinations that were available to be made available in Manitoba.
The member for Fort Garry.
Wondering if the minister can tell us how much has been paid to date to Pedal MD?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. We'll have to return with information to the member for that. We'll take it under advisement.
The member for Fort Garry.
Is the minister able to tell us when the contract will expire?
The Honorable Minister of Central Services.
Thank you, Mr. Speaker. So many of these contracts we can cancel with sufficient notice, and this is one of those. The current expiry date on that one is January 31st. and we can also extend them if we need to. You know, I do recall going to Treasury Board. I can't recall the exact month because there was a lot of things flowing together, and getting approval to book testing sites, and the contracts were running into December. And the question from Treasury Board members was, this was well over a year ago, and they're going, why are you booking these into December of 2021? We'll be done the pandemic by then. And so, you know, I don't know when the pandemic's going to be done. We need these sites, we need these contracts to be available until we don't need them. And when we don't need them, then we can cancel them.
The member for Fort Garry.
Is there a expectation or intention to renew this contract?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we're looking at that contract now because of the January date, seeing if we do need to extend it. And as things are evolving, as we're looking at the possibility of third doses or vaccinations for younger children, there is a possibility that we may need that contract, but as it's still a very, very dynamic environment that we're dealing with, and we'll make that determination at that time.
The member for Fort Garry.
In this year's public accounts on page 16, under departmental highlights for central services, it reads the following, I'm quoting here: partnered with Health and Seniors Care to establish the Manitoba Emergency Response Warehouse to ensure Manitoba has a robust and sustainable stockpile of medical equipment and materials, including PPE, to reinforce the healthcare system and public sector supplies in the event of a large-scale health crisis and other emergency situations, close quote. Can the minister confirm then that there was no stockpile that existed before the pandemic?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So if you think back to February of that year, people were still traveling. There was no warnings not to travel. We had our normal PPE supply in the health sector, and did not have any indication at that time. Health was working under the previous pandemic guidelines from SARS H1N1. And this particular virus is transmitted very, very differently, and we had to evolve as we discovered how it was transmitted. So all governments were caught with just their normal supply of PPE, and we had very few suppliers in Canada. We went all over the world to find supply and brought it into Manitoba. We had many successful companies in Manitoba that stood up production of PPE. I'm very proud of all those companies that, and I could give you a long, long list if you wished. It would take a while in this environment of that set aside their own manufacturing and found ways to manufacture N95 masks, procedure masks, visors, gowns, scrubs, all kinds of sanitizer that we are now producing in Manitoba. And as part of that process of bringing this material into Manitoba and warehousing it for a very, very high use rate in the healthcare sector, we determined that we needed to make sure that we had an emergency response warehouse available for any further emergencies that might arise in Manitoba. So we created the MERW in order to make sure that we have this adequate supply, not only for pandemics, but for other emergencies that Manitoba might face. The challenge, of course, for governments will be to make sure that we make sure that that supply is maintained and that it is cycled. It is so we have new product coming into the MERW. When that product comes in, the oldest product goes out so that we don't have any expiry issues. We'll make sure that it's all used, and we will manage the volume in that warehouse to make sure that we have adequate supply for anything that we might determine Manitoba will face.
The member for Fort Garry.
So very sensitive about putting words in the mouth of the minister. So I want to be very clear. Prior to the pandemic, we had no such emergency response warehouse in existence in Manitoba. It was created during the pandemic, and we didn't keep emergency stockpiles of PPE before the pandemic. Is that all correct?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we did indeed have a stockpile in health coming out of the SARS H1N1 issue or pandemic, I guess you want to call it. But there was adequate for some emergency, but certainly not an emergency of this volume. It ramped up all over the world, as I'm sure the member recalls, and the people responded to it in many different ways. So we did have a stockpile over and above our normal usage in Manitoba, and we have since evolved into the MERW to make sure that we can plan for any emergencies Manitoba may face.
The member for Fort Garry.
I'd like to ask the minister some questions about the North End wastewater treatment plant. I'm wondering if the minister can confirm that a contract has been awarded for that project.
The Honorable Minister of Central Services.
Thank you, Mr. Speaker. While we were I was greatly encouraged to make an announcement with the federal government and the city of Winnipeg about the North End wastewater pollution control structure. The city of Winnipeg is the municipality that would be issuing those contracts. We are a provider of funding, but the city of Winnipeg is the signatory to any contracts.
The member for Fort Garry.
Wondering if the minister can advise who's been awarded the contract for that project?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we don't comment on contracts that are tendered and awarded by another entity, be it federal or provincial. That is the role of that municipality. The city of Winnipeg would be the entity that the member should ask that question of.
The member for Fort Garry.
Has the minister decided whether he's going to reverse his directive to the city of Winnipeg to explore public-private partnerships in order to avoid the delays in construction?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So I want to remind the member that this is going to be the single largest project in the province of Manitoba. And the plan is for it to certainly last past my lifetime. The member may be quite a bit younger, so he'll maybe still be alive when they need to revisit it. It is very prudent to make sure that we have the best timing and the best value for money project available for Manitobans, that it will continue to function long into the future. And there are lots of different delivery modes that have been looked at. We're working with the City of Winnipeg in terms of what's best for the project and what's the quickest way to help solve some of these problems that we see with the wastewater going into the lake. Obviously, that's something we all want to prevent and make sure that it is cost effective for Manitobans, and that it has very innovative delivery mechanisms as well, so we can make sure that we're looking into how we can best protect the lake.
The member for Fort Garry.
The mayor has stated publicly that if he followed your directive, that there were with the insistence that there has to be a public-private partnership, that could delay the project by 2 years. And obviously it needs to be constructed yesterday. So would the minister consider rescinding his directive so construction can start immediately and there won't be a 2-year delay? Or is the minister happy with a 2-year delay?
The Honorable Minister of Central Services.
So immediately after the mayor that made that statement, I was approached by one of the councillors that was on EPC and said that they have never heard that statement be made before. It was not part of any of their discussions that they had about the North End plant. We want to find the quickest and best way to build this facility, and certainly we're not ideologically limited to what might be the best process. We'll let the market determine what's the best way to go. P3 partnerships have, we had very successful ones in Manitoba that have come in under budget and well ahead of any time restrictions, and they're very innovative in their delivery. If that's not the model for this particular project, and I'll remind the member, it's the single largest infrastructure project in Manitoba history. It's make sure that we have to get this right for Manitobans, and maybe not just for the member opposite and myself, but for any of our children in the years to come. So we are looking at those delivery models, working with the City of Winnipeg. And again, the unfortunate statement, I don't know where it came from. We've never heard that before, and councillors haven't either.
The member for Fort Garry.
I wonder if the minister can tell us which city councillor he had that conversation with.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So those are personal conversations that I have with city councillors, and there's more than one that I've heard from.
The member for Fort Garry.
So is the minister suggesting that the mayor is being dishonest or is trying to mislead the province?
The Honorable Minister of Central Services.
Well, I wouldn't wish the member to put words in my mouth. I wouldn't wish to put words in the mayor's mouth either. We're working with the City of Winnipeg to find the best delivery model.
The member for Fort Garry.
Well, I'm concerned that the minister is trying to infer that the mayor isn't being forthright when he says there's a 2-year delay. So from the province's point of view, you're saying that's not accurate. There won't be a 2-year delay if the city has to go down the route of a public partnership. Is that what you're saying?
The Honorable Minister of Central Services.
That would be correct. We have heard from the market there would be no delay.
The member for Fort Garry.
Are you in possession of the Deloitte P3 report from the city?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. I have not yet seen the report.
The member for Fort Garry.
That's certainly not what I asked. What I asked was, were you or anybody in your department or central services in the most general sense in possession of the Deloitte report on P3s?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So again, with the single largest infrastructure project in Manitoba, this is something that we spend quite a bit of time on, and there's regular meetings with provincial staff and city staff. We're aware that the city issued an RFP to Deloitte, and I have not seen that report at this point. There may have been some discussions with the city on what they expect out of it, but again, we're in regular discussions with the city, and we're going to move fairly quickly on this as soon as we find the right path.
The member for Fort Garry.
The information that we have is that you very much are in possession of that report, and I'm wondering if you will undertake here and now to provide a copy to us of that report.
The Honorable Minister of Central Services.
Well, again, I do not have the report, and it is not the province's report. It is the City of Winnipeg's report. When they disclose it to the Executive Policy Committee and Council, then it will be made public, and as that is their role and their ability to do so. It's not the federal or provincial government's role to divulge reports of other levels of government. That is the city's responsibility.
The member for Fort Garry.
So the information we have is Central Services is in receipt of that report, and I appreciate you may not personally be in possession of it, but your department is. Will you undertake to release that document to us?
The Honorable Minister of Central Services.
So any document that the city has issued an RFP for a tender and is in receipt of, it is their responsibility on how they wish to disclose it. If they share it with the department, they can do so, but we cannot share it with anyone. That is the city that will decide through their Executive Policy Committee and other committees of their municipality how that will disclose that document to the public. It would be entirely inappropriate for anyone else to disclose that document.
The member for Fort Garry.
Is your government's funding conditional on a P3 analysis?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. Well, my understanding is the RFP that the city issued was for a P3 analysis.
The member for Fort Garry.
Right. My question to the minister, is your funding conditional on a P3 analysis?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So the funding that was announced for phase one did not have any P3 requirements. That was an agreement between the federal government, the provincial government, and the municipality, the city of Winnipeg. My understanding is that the city has issued an RFP for a P3 analysis.
The member for Fort Garry.
Is it the policy of this government that any funding for provincially based will be conditional on a P3 analysis?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So it is the policy of this government to find the best delivery model for the citizens of Manitoba. And indeed, we've already flowed over 50% of the money for phase two of the North End plant. So we want to find the best and quickest way to construct this facility.
The member for Fort Garry.
Is the P3 model the quickest and most inexpensive way to do this?
The Honorable Minister of Central Services.
So that is the work that's being undertaken by the city of Winnipeg and others to determine what is the best and quickest model.
The member for Fort Garry.
Is the minister committed to funding the other phases of the North End water treatment plant?
The Honorable Minister of Central Services.
We are the only level of government that has advanced any monies for phase two of the North End plant.
The member for Fort Garry.
That's certainly not what I asked. What I asked was whether this government was committed to the future other phases of the North End treatment plant.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. We are the only level of government that is committed to funding the third phase of the North End plant.
The member for Fort Garry.
Now, in a March 30th, 2021 letter to the acting CAO, Deputies Sinclair and Gray instructed Mr. Ruda to, and I quote, please proceed with the public-private partnerships, quotations P3, market sounding as recommended by your consultant, close quote. I'm wondering if the minister could provide a copy of the consultant's report.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. Again, that report is the city of Winnipeg's report. It's not ours. We cannot disclose reports that were commissioned and paid for by another level of government.
The member for Fort Garry.
Does the minister find that disingenuous? Does he find that problematic given that the government based its decision on the consultant's report? And doesn't he believe in full accountability and disclosure that the good people of Manitoba deserve to see what the government makes their decisions based on. So I'll ask him again, will he give the report that this government used to make its decision?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. Again, it would be highly inappropriate and possibly illegal for me to disclose a report that was commissioned and paid for by another level of government without their permission. So I'd recommend that the member go to the City of Winnipeg to ask for that report to see if they will disclose it to them. I certainly cannot.
The member for Fort Garry.
The city officials have warned that privatizing operations of any wastewater treatment could introduce safety risks. Why is the minister not listening to these concerns and instead insisting on the P3 model?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we're doing our due diligence as what would be the most appropriate delivery model for this facility, the single largest municipal and provincial infrastructure project in Manitoba's history. We want to make sure that it's done well and it's done quickly in order to make sure that we can reduce the flow of nutrients into the watershed.
The member for Fort Garry.
Want to direct the minister to page 16 of Public Accounts, where it states, and I quote, completed work on the approval of over $1 billion in investing in the Canada Infrastructure Program, ICIP, projects, and played a key role in delivering capital projects within K-12 schools and work in municipalities' water and sewer infrastructure projects as part of the $500 million Manitoba Restart Program. I'm wondering if the minister could provide a list of the ICIP proposals received, how many were approved, what they were, and how many were rejected and what those were, and the amount distributed to each project. Please.
The Honorable Minister of Central Services.
So can I ask the member for some clarification? Is he looking for restart projects that were approved or funded, or ISIP projects that were approved and funded? They are different.
The member for Fort Garry.
We would appreciate both.
The Honorable Minister of Central Services.
So the approved projects are all publicly released, and we can endeavor to give him a list of both of the restart projects and the ISIP projects that were funded and approved.
The member for Fort Garry.
I really appreciate that. Thank you, Minister. Can you also give us which projects were rejected and how much money was distributed to each of the projects that were not rejected?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we haven't rejected any projects. As the member well knows, there is an infrastructure challenge in Manitoba, and we are oversubscribed in the ISIP stream, but that doesn't mean that we rejected any projects. We found ones that we were able to move to the federal government with the municipality or the proponent, and the federal government decided which ones they were going to approve, and they have done that so for the majority of the projects we've advanced to them, but not all of them yet. And but again, this is a long-term 10-year infrastructure program that we're working through with our proponents and with the federal government.
The member for Fort Garry.
Wondering if the minister could provide the number of rapid COVID tests received and the number used since March 1st, 2020.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we have received from the federal government to date 1.4 million tests, rapid tests, and we have shipped 1,130,700 of these tests to 616 sites in Manitoba.
The member for Fort Garry.
I'm wondering if the minister can give us a status update on the ExploreNet contract.
The Honorable Minister of Central Services.
Thank you, Mr. Chair. I'm sure the member knows we issued a binding MOU in order to enter into negotiations with ExploreNet, and we are in the final stages of those negotiations.
The member for Fort Garry.
Could the minister provide a copy of the Memorandum of Understanding?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So much like contracts, these are subject to both parties allowing the release. We would have to go back to ExploreNet to see if they would allow us to release the MOU. The member may recall that the Providence MOU was released publicly, and we can do that with the agreement of Providence, but we'd have to go back to ExploreNet to ask if we could do so.
The member for Fort Garry.
Will the minister undertake today both to go to ExploreNet and see if they will consent to that disclosure, as well as 24/7 and disclosing their contract as well? Will you undertake to do that?
The Honorable Minister of Central Services.
We certainly agreed that we would go back to 24/7. We already took that under advisement that we could ask them, and we'll ask ExploreNet if they would allow the release, the MOU, and we'll see where that goes.
The member for Fort Garry.
I really appreciate that. Thank you, Minister. What is the valuation of the ExploreNet contract?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So there's no value attached to this contract. The value to Manitobans is going to be 125,000 households or businesses that will have access to broadband that they currently don't have, and that is 90, what percent? 90, well over 90. 92% of the possible unserviced households in Manitoba, as well as 25,000 additional cell phone accesses that could be made available. So that's the value of the contract to Manitobans.
The member for Fort Garry.
Is Hydro responsible for the valuation of the contract, or is your department or government managing that process?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. There is no valuation of the contract either by our department or nor by Hydro. It is basically an enabling contract that would allow the development of broadband to all of these houses in Manitoba, over 125,000. That is the value to Manitobans. Any additional cell service that will be available to another 25,000 Manitobans. So in terms of a value of the contract, it's the value to Manitobans, but there's no evaluation of the contract value. It's as I said, it's a enabling contract to make sure that we can provide those services to Manitobans.
The member for Fort Garry.
How many contracts were transferred over to ExploreNet for access to the dark fiber?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So no contracts will be transferred for the purposes of access to dark fiber.
The member for Fort Garry.
I'm wondering if you're able to tell us how many Manitoba-based companies and what's the value of procurement goods or services that is purchased by your department by them?
The Honorable Minister of Central Services.
Thank you, Mr. Chair. So we do have a very open procurement process, and with all the trade agreements that we are party to, we have to make sure that there is no favoritism for solely Manitoba companies. And I already did in my opening statement tell the member that of the $460 million in pandemic response supplies, equipment, and vaccines, over 241 million, or about 45% of those, went to Manitoba companies, and I'm very, very proud of those companies that stepped up to help us. And I can tell the members some of those companies that you know, we can look at. Canada Goose was part of that, and they were working on over 100,000 reusable gowns. You know, contract value of over $2 million. Cerebral Health's Winnipeg Ventilator was a part of that. Diesel Custom Sewing in Morden was, again, reusable gowns. Icon Technologies that I visited the facility there with the MLA for Morden Winkler. They retooled their entire manufacturing to supply Manitoba with 60,000 face shields. Contract value of 498,000 there. And when I spoke to other procurement ministers and health ministers across Canada after we had settled on that contract, and we visited Icon. We were taking, I think, just over 4,000 shields a week and looking at their facilities with a few staff they had working there. I asked them how many they could produce a week, and they said, well, somewhere between 45 and 50 or 60,000. And when I told the other procurement ministers across Canada about that, I think they sold out immediately. So some great.
Order, please. I'm interrupting the proceedings of this section of Committee of Supply pursuant to the sessional order passed by the House on October 7th, 2021. Items 5(d) stated that on Wednesday, October the 13th, 2021 at 6 p.m., the chairpersons of the Committee of Supply in each section will interrupt debate and put the question immediately without debate on any remaining estimate resolutions. The sessional order also indicates that for any requested recorded votes, the division bells shall ring for no more than 1 minute on each question, and the committee and the House shall rise following the consideration of the last resolution. I am therefore going to call in sequence the remaining resolutions for this section on the following departments: Central Services, Tax Credits, Emergency Expenditures. I would remind all members that in accordance with the sessional order, these questions may not be debated. At this point, we will allow virtual members to unmute their mics so they can respond to the question on the resolution. This section of the committee supply will now consider the estimates of the Department of Central Services. Resolution 8.1. Resolved that there be granted to Her Majesty a sum not exceeding $1,262,000 for Central Services, Corporate Administration and Planning for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 8.2. Resolved that there be granted to Her Majesty a sum not exceeding $220,065,000 for Central Services capital programs for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 8.3. Resolved that there be granted to Her Majesty a sum not exceeding $43,266,000 for Central Services, Business Transformation and Technology for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 8.4. Resolved that there be granted to Her Majesty a sum not exceeding $7,467,000 for Central Services, Procurement and Supply Chain for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 8.5. Resolved that there be granted to Her Majesty a sum not exceeding $17,889,000 for Central Services, Public Safety Communication Services for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 8.6. Resolved that there be granted to Her Majesty a sum not exceeding $56,200,000 for Central Services capital assets for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 8.7. Resolved that there be granted to Her Majesty a sum not exceeding $21,790,000 for central services, other reporting entities, capital investment for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. This completes the estimates of the Department of Central Services. The next set of estimates to be considered by this section of Committee of Supply is for the Department of Tax Credits. I will now call resolution number 33.1. Resolved that there be granted to Her Majesty a sum not exceeding $152,759,000 for tax credits, tax rebates and fees for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. This completes the estimates of the Department of Tax Credits. The next set of estimates to be considered by this section of the Committee of Supply is for the Department of Emergency Expenditures. I will now call on Resolution 27.1. Resolved that there be granted to Her Majesty a sum not exceeding $100 million for emergency expenditures for the fiscal year ending March 31st, 2022. Shall the resolution pass?
Pass.
The resolution is accordingly passed. This concludes our considerations of the estimate in this section of the Committee of Supply. I would like to thank the ministers, critics, and all honorable members for their work and dedication during this process. Committee rise.